administrator and also work as an oncology nurse. So spend the day with me.
Hi, so I come to work by 8:30 or 8 a.m. as it is, and then I try to ensure that everything we have for that day is available. For instance, every procedures, we try to be sure that those involved are aware of what they're supposed to do, like the surgeons, doctors, and the nurses. I also ensure that the nurses for every procedure, we have enough nurse for per procedure. And I also check as the admin to be sure that we are doing every procedure according to standards, according to precautions as it should be. I also go through our SOPs daily and try to review them, see the one to review and see what to add or subtract on a daily basis. All right, so administrative nursing is a branch of nursing that has to do with policy making and ensuring that procedures are done as standard. And we also try to develop SOPs to align with what you have depending on the specialty you're in. Involved in decision making for the nursing department, trainings and anything that has to do with legislative work, more like it. So that's what you're doing. And you also ensure that things that should be conveyed to the management from the nursing angle, you're in charge of that. So really, I think for some nurses, we really don't have so much experience about administrative nursing because we are more confined to probably bedside nursing or other aspects of nursing. But I believe that administrative nursing is what would kind of bring more changes in nursing, because if we don't have policies that favor the nurses, we don't have policies that kind of speak up for us, we would not have people making decisions for us. And do not forget that the law depends on who is making it, and that would also determine your outcome as a nurse. So we have more nursing administrators, we have people in legislative arm, we have people in government. Of course, would have better outcomes in the clinical aspects in nursing, because it will also come into play in other aspects of nursing career. All right, so oncology nursing to do with taking care of patients and giving them treatments to minimize or alleviate cancer growth, and also probably reduce the barriers minimum and try to manage them palliatively too. So what we do as oncology nurses or cancer care nurses is we tend to give patients, of course, the treatment might be chemotherapy treatment or radiotherapy. So basically chemotherapy, you're giving them infusions while protecting yourself to help to reduce the spread of the cancer or restrict it to a particular cell. Then also, we also prepare patients for PET CT scans. So PET CT scans are scans that help to show the spread of cancer in the body. And also, we also use it for staging of cancers also at those points, basically. So we try to prepare the patient, check that they are okay for the test by checking their vital signs and be sure that they are fit for the investigations. Okay, so for me, going into administrative nursing was not something I planned out from start, because like when I entered into nursing, I did not even have the interest so much in nursing. I wanted to always be a lawyer, but things happened and I got into nursing. So, but I knew right from time I had interest in policies, leadership, management, and all of that. And I kind of geared towards that part. But I knew that for me to do those kind of things or be in those kind of categories, I have to have understanding of some clinical parts. So I chose to do specialties like radiology, cardiology, IVF, and the like, so that I have understanding. I cannot make policies on something I do not understand. To gear into leadership, management in nursing, and it's been awesome and I'm still growing in it. So basically, I entered into it because I wanted to be part of people that will make decisions in nursing. I realized that some of the issues we have in clinical nursing, because we have policies and laws that really do not favor us as nurses, because we've not been able to have people speak for us where it's necessary, like in the boardrooms. We're used to having nurses in the wards and not nurses in the boardrooms. So I felt like if we had more nurses in the boardrooms, nurses in the ward would actually be favored and their decisions be considered. So I felt the best way to do that is to come into administration, come into leadership, learn, do certification, skill acquisition and all of that, so that I can be better informed to make better medical decisions and be able to deliver better care. So that way, when I'm able to marry those two together, even if I decide to go into clinical, I'm going in with a better mindset. I've been able to put down policies that would favor my nursing department, such that we can now be able to align to reach the greater goal of the organization. So we just finished assessing the patient, and we did procedures like percussion, auscultation, inspection, and the likes. And we took histories because history is very important in cancer care. We want to know the symptoms they have, where they work, and if they've had children or not, because cancer can affect fertility. So we took all of that and just finished. And I think I started with taking initiative in the department. Okay, well, there's something to do, and probably we need some equipment to use, and it's not available. Or how can we get? Like I tend to go the extra mile. I think that's how it started for me. And if you come to my department, you want to take things, I want to ask you. I'm asking you, what do you need it for? So that ownership mindset was always there, right? So nurse manager at the time had to leave, and then the leader had to put in someone to take over from her, and that's how I became the acting manager at the time. Then grew into being a manager, and I just went on from there. But it came from knowing that, see, for you to make a change, it has to start from you. You have to understand why that change is important and know how it can serve the greater community. And at some point, I had to do some certifications in quality control, quality assurance. I learned that on the job, and I actually got to learn through seminars, conferences, and all of that. So at some point, I did a certification in nursing leadership and management for 3 months in Coursera about. So I did certifications, and I also went for seminars and conferences that gave us certificates. Yes, to that. And I've been learning over time, reading books, basically reading books of leaders and how they've been able to change things and how to be a better leader. Because admission is basically about being a leader and learning to do things that would better the good of the nurses and the larger community. All right, so for me, I think the first thing is to ask yourself the question, what do you really want to solve in nursing? What do you really want? Do you just want to do the status quo, or you want to do something different? So that way you are able to make informed decision of what you really want to do. So for me, like I said, I wanted to just give my voice and make a change. And I know for me to do that, I needed to do administration. So for other nurses, I would want to venture into other things. First thing, like I said, what do you want to do? What do you intend changing? What is your goal, basically? And then that way you're able to align and then look for people that are in that category, work with them. At some point, I had to pay for a mentorship with some of these persons. It's also important. You can't project something that you've not seen, really. So you have to find a way to get close to those people and also have a big picture. I believe that everything in life it's yeah, money is important really, but I believe more in impact, right? So and you can't make impact without getting knowledge. Knowledge is a very big instrument in getting that done. So what do you want to do? What are people that are working in that light? Then be ready to push yourself, because at some point I had to learn some skills. Let's say for instance using ultrasound to cannulate patients, and I had to learn that doing overtime. At times I would not go home. I'd work over the night because I wanted to gain that skill, because I cannot have patients that have different veins, for instance, and I know that I can use an ultrasound to cannulate. I had to go and learn the skill. I had to take more time off work just to learn that. That sometimes you have to look at the bigger picture and see how best to serve not just where you are, but then the larger community.
So, Nurse Vivian, what other things can nurses venture into the medical space?
Okay, there are a number of things nurses can actually do. First, you can look into telemedicine. The future now is technology. You can look at owning a pharmacy in collaboration with the pharmacist, of course, because you have to know the licensing for where you stay. You can also look into health entrepreneurship, for instance. You can have a health business like probably a medical store. You can have an ambulance business. There are many things to do, basically, but you have to know what you have, what you're ready to solve, and what your environment needs to. Very important. Those are factors that will determine it. Alright, so we just finished the port catheter insertion. So a port insertion is done for access into the subcutaneous tissue, and is used to give infusions, chemotherapy infusions. It's preferable because for chemotherapy drugs or infusions, they kind of have side effects when given through peripheral access, like burning the veins. So port ACAT is better in those instances. So basically, for the procedure, you work with the surgeon, the resident doctor, and then the nurse is available as well. So I just go in to supervise or assist as necessary. So basically, it's a chemotherapy pot tray itself. It has everything inside of it. Make sure that is available and give assistance as necessary. And once we're done, we make sure the patient is comfortable. Then you assess the pot using a what they call a Uber needle. So Uber needle is used to infuse into the catheter. That's the syringe you use to give the infusion. So you just plug it to the infusion or connect it to the infusing bag, and then patient's good to go.
Okay, tell us about HEEBDA Enterprises.
Oh, okay. So HEEBDA Enterprises is a registered business in Nigeria, healthcare business in Nigeria, and we've been on for about 4 years now. So we started with supplies of medical equipment and consumables, started like that, and we grew on to getting medical coverages. So when you have an event, we go to cover your events and partner with ambulance services too, just when necessary and as needed as it is. Then HEEBDA too, we also have some other things coming on board. So right now we're working on getting a medical website where people can get to order what they want and get it delivered in any parts of the country. We are starting from Nigeria. We also have a telemedicine app also called Vitanips Health, collaboration with a team of other professionals in tech and all of that. So we are trying to solve the issue of people come to the facility and they're not getting attendance early as they should, probably because we have a lot of patients there or they've not booked before them. So the telemedicine app, or like it works, will just help you see a doctor. You'd have a conversation with the doctor, and the doctor will also help to place you on medications and give you the necessary medical advice. And if you need to come to the hospital, probably it's an emergency, we have ambulances we've collaborated with that will bring you down to the nearest facility or to where the doctor has referred you to, and you get the necessary treatment. Also, it also has pharmacy prompt. The prompt will help you, would get your drugs across to you, dispatched to you when necessary. It also has some other things that would teach you about how to take care of your health, other health tips, because knowledge is really important. Then we're also working on a hub for nurses also. What would this help you do? For nurses that registered nurses and qualified experienced nurses, you're able to get them. It also helps you to get the closest one to you. So we are working that soon, and in March we'll be launching out. So basically there are many things, like I said, that nurses can do. We can look into tech. I mean, the future now is technology. So how can you bring that in to play?
So who are the medical professionals and other personnel that are involved in this app?
Okay, so we have medical and non-medical. So for the medicals, we have the nurses, the doctors, specialists actually, because we are trying to also solve an issue of people coming to get specialists as early as we can, because sometimes when a person tells that they have some issues, let's say they're having issues with their skin, and we know that there are different specialists, but they don't know. So this app would also help to solve that issue. So to help them to see the dermatologist and also the specialists, any other specialists as they would. Also work with pharmacists also, and we have the IT technicians too. Those that would help to develop the app and help to improve it as necessary. So nurses can venture into other specialties, other really nice specialties like radiology, for instance. Into fertility nursing, IVF is very interesting place to be. You can also venture into aesthetics too, cosmetology as a nurse. There is nurse tutoring and nursing education, so that the ones that help us get knowledge and mass knowledge. So you can venture into you have a flair for teaching and lecturing. Something, it's a good thing to also venture into. So they can also go into health education and all of that. But the thing is, we have to understand that, because I feel like we are kind of too confined to working in the world, that we do not understand how these things work. Now, for instance, you want to do a telemedicine app, you know that some persons have to get involved, like the tech people and all of that. And yes, there are nurses doing a lot in tech. There's virtual nursing, and there is nursing informatics, a very good thing to do. So, but try to not put yourself in a box. And as a nurse, try to be very open-minded. Curiosity will help you in this career. Was one thing about me, I'm really curious of what's going on there. I'm very inquisitive. I like to ask questions, even if it looks like not a question I ask, but I will ask anyway, because you learn by observing and you also learn by asking questions. And then try to get involved in these things and read a lot, do a lot of researches, pay money into mentorship. It will help you in the long run. So thank you for spending the day with me.